I'm Mark Halperin. This is Wide World of News. We're talking today about what America is focused on now. Some of the best minds from coast to coast trying to figure out how can the country safely reopen in the midst of still a lot of scientific and medical and social uncertainty about the safest way to reopen. Some people think there's no safe way to reopen. There are a lot of plans that have been put out by academic institutions, some coming out of the government. We're talking today with someone who's part of one of the best plans that I've seen out there. Lanhee Chen is a fellow at the Hoover Institution, a lecturer at Stanford's public policy program, and he and his colleagues at the Foundation for Research on Equal Opportunity have put out a plan this week that is getting a lot of attention along with some of the other major plans. And Lanhee also has worked in politics, which gives him a perspective that some people in the academics don't have, in the academy don't have, about what the traffic will bear. So Lanhee, thanks for joining us. Appreciate
Thank you, Mark. Thank
it.
you.
There are, as I said, a lot of plans out there, and there's obviously going to be overlap. But what would you say, you and your colleagues, the plan you've put out, what are the major elements of it that differ from some of the other plans?
I would say, first of all, Mark, it's the assumptions that went into the different solutions in the plan. You know, I think we all want to be optimistic about things like expanding testing capacity, or our ability to get to a vaccine, or ability to get to therapeutics that will work in a really reliable way. And I think the question the place that we departed from was, well, what happens if it takes longer to get those things? What happens if we're not able to arrive at the kinds of breakthroughs we want in a period of time that we would hope to be able to have them? And so we look at really, how do you ensure that you're not just looking at this false dichotomy between shutting the entire economy down and reopening everything? What does that look like in between? So we've really focused, for example, on things like, how do you get people who are otherwise healthy, under the age of 65, how do you begin to get them back to work? How do you get kids back to school? Because that's something that's critical to getting our workforce on track. How do you get air travel restarted if not everybody has immunity? Those are the kinds of questions that we've tried to deal with in the plan.
My view of your plan, you tell me if this is a good way to characterize it. It's a plan based on pessimistic assumptions, but an optimistic plan.
No, I think that's right. I think, and there are things, for example, like contact tracing that are a basic tenet, I think, of pretty much every proposal that I've seen to restart the economy. And look, we want to be optimistic about contact tracing being effective. But for that to be effective, you got to have two things: a lot of people and a lot of money. And in the absence of a lot of people to do contact tracing, or the right funding to agencies to enforce contact tracing, or even one more step beyond that, the technology that might enable us to do more contact tracing without having to deploy a lot of people or a lot of money, in the absence of all of those things, the question then becomes, how do you put together a plan that might be responsive to the needs of people and the needs of the economy to begin to get back up, given that this crisis will probably go on in some form for some time?
Right. I want to give people a chance to follow along at home. What's the easiest way? Maybe you just come up off the top of your head, a good Google search. What's the easiest way for people to find your plan?
I think the easiest thing to do is to go to the Foundation for Research on Equal Opportunity, which is not the think tank I'm principally affiliated with, but I'm a director of the think tank, and a good friend of mine, Ovik Roy, has started it. The website is freopp, FREOPP.org.
All right, so go to that website if you want to follow along and start skimming through the plan as Lanhee Chen and I talk about it. So one of the things in your plan, and there's a lot of parts to it, we're obviously not going to cover every element, but one of the things is you say only people who don't have the virus should be able to fly on planes and get on trains. We haven't shown as a society so far that we can do some of the basic things. How would that work? How if someone was desperate to fly, couldn't they find a way to get some sort of forged document or forged electronic device certificate? Isn't that a real challenge to do?
Well, I think there's a couple things. First of all, we do need sufficient testing available, maybe not at the level that some have posited. You know, the numbers we're hearing of sort of 20 million folks a week being tested. We're not talking about that. We're talking about enough tests potentially, for example, to administer them, hopefully with a quick enough turnaround that maybe you could even do it at the site of travel, or going, at the check-in counter, maybe even. If we can get a test, for example, that can turn around a result in an hour or two, then it enables it to be part of that travel process. You're right. I think the challenge is if you begin to say, well, bring documentation, that starts to raise some questions about the authenticity of documentation. But, aside from that gaming of the system, what we really want is we want to be able to see there to be an opportunity for people to get those tests, to have that certification as part of the travel process, that would be the easiest way to do this.
Right. So that's one way in which your plan assumes and relies on a lot of private sector testing, a lot of companies doing tests, airlines doing tests, or TSA doing tests. The government hasn't been able to do that. The private labs have struggled. And it doesn't seem like that's their core competency. You know, Walmart is not in the business of medical tests for their employees. So how do you envision corporate America ramping up to figure out how to do this quickly and well?
Well, one thing we propose in the plan is giving employers a tax credit, basically, to be the ones to administer these tests for people coming back into the workplace, so that they will have some comfort, both the employer and the employees working in that workplace have some comfort around who is there and whether, in fact, for example, they have immunity to COVID-19. And so one of the things is we believe in order to get testing more widespread, you do have to get the private sector involved, you have to get employers involved. But of course, you do need that technology. You need, and not just, Abbott Labs, for example, has a great test that so far I think has been very well reviewed and regarded. But you have to have even more companies producing these tests. And particularly on the antibody side, we really don't have an FDA approved, so to speak, test yet. We've got a couple of testing providers that are operating under emergency use authorizations. That's really going to have to expand significantly. We're going to have a great deal more confidence about, for example, the ability of those tests to properly detect antibody levels, and for those antibodies to be protective from getting reinfected, which we don't really know if that's the case either. So employers are going to have to get involved, and we're going to have more testing capability for all of this to come together.
One of the macro challenges here that your plan, implicitly addresses is it's a national plan. It's not a state by state plan. And as we've seen, based on the political inclinations of some of the governors, how severe the problem is now and might become in these states, a lot of people say a one size fits all plan isn't going to work. So is your plan something that will be as applicable to New York as it would be to North Dakota? Or is your plan focused more on the states that have been hard hit?
Well, I think the good thing about a proposal like ours is that it is going to be able to be tailored based on where you're administering it. So, for example, one of the things we talk about in the proposal is opening schools. Now, that's going to be much more difficult in some places where the prevalence of COVID-19 is greater. You're going to have more people potentially in a hotspot. It's going to be hard to bring kids together. Maybe you've got some communities where caretakers tend to be more elderly, and obviously we want to shield those people from the threat of this. So it's not going to apply equally, but there's some basic principles in place. If you can bring kids back into school and ensure that you are doing things like cohorting them, for example, so you're more easily able to track spread of the disease if and when it happens. You're able, for example, to have a robust distance learning capacity to supplement for those kids who can't be in school. They're able to get access to the same amount of information. That won't necessarily apply in the same way in New York as in California. But we wanted to give sort of a set of principles, a set of ideas that different states could apply differently. Some states are going to want to try and set up some kind of way of determining who's driving into and out of their states. We saw this already with Louisiana and Texas, and there was some controversy around that. So we say, look, why doesn't the federal government give the states some presumptive ability to do these sorts of things? So we really tried not to create a one-size-fits-all solution, but tried to apply principles that we believe will get this economy going and allow states the flexibility to implement it in the way that's suited best.
I want to go back to something you said about school, because so many parents, we're both parents, and pretty much any parent with a child in school or children in school is thinking about the spring semester's gone. What's the fall going to look like? You talked about, use the phrase cohort, keeping them together in cohorts, basically saying you're not going to go from different class to different class with different classmates, but you stay with a single group of classmates throughout the day. Does that work for preschool up to seniors in high school, or is this something that will only work in some places in some cases?
Yeah, we're going to have to really, again, need to apply it to specific situations. They might have different kinds of outcomes. So it may work very well in the 3rd and 4th grade. It's going to be more challenging when you get to high school and you need someone to teach biology, and that person is not the same person who's going to teach English. So we're going to have to figure out how to do some of that. Maybe it's combining some distance learning with some in-person learning. So there's a home base, students stay together, and then different subjects get beamed in. That's one possibility, but they're in the physical school location, the schoolhouse, if you will, so that parents are able to get out and go to work. One of the challenges is if you don't have the school situation synced up with the work situation, it's really hard for parents who need childcare, for example. So one of the things that we posit in the plan is that reopening the schools is actually a really important piece of this, because what ends up happening is if you don't reopen the schools, you begin to create even more significant disparities in outcomes between people who are middle and higher income, who have capacity, for example, to outsource or to hire people to provide childcare, and those in the lower middle income category who don't. So the sooner we can get the schools reopened, the more the economic recovery can begin.
Your plan is written in a very, again, optimistic way to try to deal with the worst case and to try to turn things as quickly as possible. What are your one or two biggest worries now about how the country is going to address this notion of reopening?
Well, my first worry is just our expectations about what reopening means. You know, I think we all want things to, quote, go back to normal. We want to be able to go to baseball games. We want to be able to go to the movies. We want to be able to enjoy our favorite restaurants. And I think some of that will be possible sooner than others. But I think we have to have a realistic expectation about the fact that things aren't going to go back to the way things were exactly, maybe not for a while at least. And so let's just have the right expectations about what a restart looks like. And then the second thing that I worry about are the long-term repercussions of this economic downturn that we have just entered into. There are a lot of jobs that probably are not going to come back for a while. For example, you've got a restaurant that has shut down. They may not be able to hire back those workers. That restaurant may not be there for a while, or maybe even in the same form ever again. So we just have to be prepared for these massive disruptions in the economy, and just know that it's going to take us time to rebuild, just like it took a lot of time to come out of some significant economic crises we've had in our country in the past. Let's not expect the bounce back to be quick or instantaneous. Let's be patient in the recovery of this.
Is the public health community and the medical community in this country, obviously in a lot of places, New York most particularly, but other places, they're exhausted. They've been dealing with this. Are you concerned at all? Does your plan address the question of what do we expect now from hospitals, doctors, public health officials around the country to try to be part of turning back towards as much normalness as possible?
You know, one of the things, Mark, that I don't think enough people have talked about is just how fundamentally the healthcare profession the healthcare industry has been affected by this, not just in terms of needing to find tests and a vaccine and you know, medicines that work, but just in terms of how much, for example, hospitals have had to change how they do business. Hospitals have not done elective procedures, you know, many of them in a month. Volume is down 80%, 90% in some hospitals. So the question is going to be, when we begin to ramp back up, how do we ensure that hospitals and doctors can see the patients they need to see, while also creating some capacity when and if coronavirus comes back in some communities? So we've got to create that surge capacity and leave that capacity there, while also allowing healthcare providers to go back, for example, to treating more patients, to dealing with conditions that are not emergent. That's going to be a very difficult thing to balance, quite frankly. The federal government may have to come in and think about how it assists, whether financially or otherwise, some of these healthcare providers. But the healthcare industry will never be the same after this crisis.
Right. Lastly, I just want to ask you if there's anything about the plan that you think is distinctive about your plan. Maybe you want to make sure everybody listening to us understands that this is something that you feel strongly needs to be part of the solution as we look for a consensus.
Well, we've talked about the schools. I think really having a smart plan to reopen the schools, to get kids back in the classroom to the extent possible, I think that's a really important thing that I don't think I've heard nearly enough dialogue about what that looks like, what some of the challenges might be. Maybe thinking about the school day, and in fact, if we can use those distance learning things in that context, that's one thing. And then the second thing I would just say is we do need to think critically to go back to the issue we started with about travel. How do we get travel within the United States, between the US and other countries? This free flow and free exchange of people and ideas was so important to the economic vibrancy, not just of this country, but of so many places around the world. If we can't figure out how to get travel restarted in the right way, it's going to have an impact on more than just the travel industry. It's going to have an impact on all of us. So we've got to think intelligently about how to get that online. We present some ideas and thoughts on how to do that, but we don't pretend to be the final word on that. We'd love to hear more thinking and analysis on how that might work.
Before all this, you traveled a fair amount for work and other purposes. What's it going to take to get you back on airplanes?
Well, I do think having some comfort that the people around you on the plane do not have the infection, the virus, or having confidence that I myself might have the antibody. I think that either of those things. So it does come back to testing. It does come back to ensuring, I think, also that some of the enhanced safety procedures the airlines have put in place during this period remain. More frequent cleaning, trying to provide some distancing in seating, which will be tough because they're going to want to pack those planes to get their margins back up. I understand that. But some of the things that have been put in place during this period of time, I hope those practices carry on.
Okay, I'll link to the study in the video as it's posted, but tell everybody again, what's the best way to find the plan that you and your colleagues have put out?
You can go to freopp, FREOPP.org, and check out the plan there. And love your comments, love suggestions. You've got a great group of readers and consumers of the material you put out, Mark. It's an educated and smart, savvy group. We'd love to hear more about what we're missing, what else we could be doing, because we're all in this together, and we're not going to be able to solve the problem unless we work together to do it.
I agree with all that. Lanhee Chen of Hoover and Stanford, thank you. Thank you for putting out this plan. And I would love to hear, as Lanhee would, anybody who has a reaction to the plan and thoughts about how to improve it or questions about it. So Lanhee, thank you very much. I hope you and your family stay safe and well, and I hope we can speak again soon.
You too, Mark. Thank you.
I'm Mark Halperin. Thanks for watching. We'll have another conversation coming up very soon here on Wide World of News.